All right, welcome back. This is Dr. Jin Sung, and today is Tuesday, 12:30, and we're going to review a ketogenic diet for you. Last week we talked about Alzheimer's disease and the use of fats in order to help improve brain function. This week we're going to go a little bit more in detail and explain to you what a ketogenic diet is. Essentially, in the United States, the obesity rate, or people who are overweight, runs into the 50 and 60 percentile. So if you went to the mall or in the airport and you just kind of look at what's around you, you're going to see that every 6 out of 10 people are going to be overweight, right? So it's become almost, common nature or basically normal to see people who are overweight, and everyone just thinks about it, it's not a big deal, right? Essentially what happens in the United States is that we are full of carboholics, basically sugarholics, right? People love sugar. You see the people with a big gulp at 7-Eleven and it's like 64 ounces of sugar, right? Or they go to Starbucks, instead of getting a cup of coffee, they get a cup of coffee with extra cream and extra sugar and this and caramel and whatever, right? So we essentially feed ourselves with sugar throughout the day. And essentially we do need sugar for function because that's what is produced. ATP is produced utilizing some sugars, and muscle is fired off and the brain function is utilized using some sugars. But what we don't expect from this sugar is that we have these insulin spikes. So these high spikes of insulin that go up and down will eventually lead you down the road of diabetes. And diabetes in itself will create inflammation, loss of peripheral vascular perfusion, so you get fungus in your toenails. It's going to create a lot of different problems when you develop diabetes. So how do we reverse that? Essentially, if you took carbohydrates and eliminate a good bulk of it and utilize more good fats into your diet, then we can use something called ketones. So the body will basically take your sugar, right? So if you ate a bunch of sugar, it does two things. It does glycogenesis, basically it takes your sugar and stores it into your liver and into your muscle tissues, right? The other thing it does, if you have excessive sugar in your system, is that it causes lipogenesis or fat genesis, right? It stores it into fat, so you get obese. You gain more weight, and more fat tissue, etc. So if we eliminate the fats and if we eliminate the sugars and we incorporate more fats, our body will start to produce more ketones, which can be an alternative fuel for your brain, your muscles, and everything else. So the ketones that are produced from your liver, right? It's produced from your liver, is called acetoacetate. Acetoacetate will break down into something called BHB, right? Beta hydroxybutyrate, and then acetone. Acetone is basically, if you go into ketosis, you're going to have some waste material that's produced called acetone, and you're going to smell it in someone's breath. It kind of smells foul, right? That is the waste material of burning the ketone bodies in your body. So it's a way to get rid of it, okay? And you get rid of it through your liver and your kidneys and sweating also, right? So it basically, your ketones switch and then utilize different fuels for the brain and the muscles, right? So let me just give you an example of what a ketogenic diet is. Essentially, you're going to have more fats, smaller amounts of protein, and even smaller amounts of carbs, or net carbs. So I need to explain what net carbs are, net carbohydrates. So if you had 1 cup of broccoli, okay, and it's equivalent to about 6 grams of carbohydrates, and 2 grams of that 6 is essentially fiber. So you take the total carbohydrates, you minus out the fiber content of it, and then you get net carbs. So broccoli has 6 grams of carbs, 2 of it is 2 grams of fiber, and the net carb of 1 cup of broccoli is 4 grams. So 6 minus 2 equals 4. Essentially, we do not want to exceed between 20 and 30 grams of net carbs in a day. So if we took a patient who has, let's say, 1,600 calorie diet, and we put them on a ketogenic diet, right, 1,600 calories, about 136 grams of fat, 74 grams of protein, and about 20 to 30 grams of carbohydrates from vegetables, essentially, right? So if you take your body into ketosis, it's got many different benefits, especially people who have neurodegenerative disease in terms of brain function. So the early onset Alzheimer's, the dementia, even post-concussion patients who've had brain trauma, if you give them an alternative fuel other than glucose, you can start to make the brain function better, right? So there are a lot of different benefits for it. You can, it's great for weight loss, right? It's great for energy production. It will decrease bad cholesterol, improve good cholesterol, and also will decrease triglycerides in your blood test. And it's contrary to what you think, because you're utilizing fat, so you would think triglycerides would go up. But in many people, it actually drops, right? The other thing it does, it helps manage blood sugar, because you're not taking in the high carbohydrate load. It manages things like insulin resistance and diabetes to a certain extent. And then also decreases cravings, because you're not fueling your body with sugar, you're giving it fat, and the fat has to be converted to something called ketones. Okay? And then it's also great for your skin because you're taking a lot of fatty tissue. Fats are necessary for brain function because a lot of these cells are bilobate layers of fat. So you need fats in order to work. Now, if you're going to do a ketogenic diet, I suggest you go and really research this or work with a medical professional who understands how to do this. There's a way to test for ketones in the urine. They're called ketone strips. You can buy them on Amazon. You want to make sure you get into ketosis in order to make it beneficial for you, all the work you're going to do in terms of preparation of food, etc. The other thing that you look at is if you had a person who's utilizing ketones and you truly want to push them into ketosis, right? You can do intermittent fasting. So essentially what you do is you can have all your meals between a 6 and 8 hour window during the day, and the rest of the time you are fasting. Now, I would not recommend this for someone who's got hypoglycemia or low blood sugar issues. Then you need to really be managed and looked after carefully. But again, the diet is not meant for everyone, but it has a great benefit, and a lot of people don't understand it, and a lot of people don't know how to utilize it. So if you did a ketogenic diet, I would suggest looking at what are good fats, how much protein to take in, right, and how many net carbs. There are a lot of different calculators online. Just look up ketogenic calculators or net carb calculators. You have all these things that can help you, applications on your phone that can help you through the ketogenic diet, right? So ketosis can be very beneficial for a lot of neurodegenerative processes and brain dysfunction issues, especially Alzheimer's, late onset dementia, and so forth, and also for people who have epilepsy or people who have seizures. You definitely want to work with a medical professional on that and make sure you're doing it correctly to make sure you're getting into ketosis. I'd like to thank everyone who watched last week. It was a great seminar. I think it opened the window to neurodegeneration. So we'll talk more about neurodegeneration, Alzheimer's, and things that you can do to help overall brain function and how to boost the brain. Because essentially your brain is your control center, and without it, things will start to break down. So you have to be able to feed it the right nutrients, give it the right environment, and then your brain will flourish and your health will improve. Because oftentimes people come in and their main concern is, oh, doctor, I can't lose weight. Well, essentially what's happening is those people are inflamed, right? You have to get them healthy in order for them to lose the weight. So that process may take some time for that patient to lose weight. So it's very important. So those of you who've been on those yo-yo diets going up and down, up and down, up and down all the time, start looking at a ketogenic diet. But again, research it very carefully before you go on something like that. And I really do highly recommend working with a medical professional on going on a ketogenic diet, especially if you have a lot of underlying health issues, okay? So I'd like you guys to share and like the page so you can get continual updates on the videos that we make every week. We want to provide excellent information for you guys, and we'll see you guys on the healthy side. All right, we'll see you next week.